Welcome to this session in which we will discuss how to mainstream protection in information management activities in humanitarian context. My name is Daunia Pavone, and I will be narrating this presentation for you. The 8 principles for protection information management are useful to guide us through the process of mainstreaming protection in information management activities. In particular, we look at the do no harm principle, but other principles will also come into play. So how do we do no harm when collecting, storing, analyzing, and using data? There are various ways. These are some examples. Avoiding questions that may expose people to risk. Explain to respondents accurately how their data will be used, published, or shared, and asking for informed consent. Conducting a data sharing risk analysis. Which data can be shared with whom and how. Start from use and information needs when you start your data collection exercise. Do not start from questions and questionnaires. This relates to the PIM principle of defined purpose, and we need to have a defined purpose for each question. Ensuring that the data are collected using the appropriate method and source. Accompanying the data and reports with a detailed and transparent methodology chapter. And the last example of what we can do to mainstream protection doing no harm is sharing the questionnaire together with the datasets or reports so that the user can correctly understand your data and therefore reduce the likelihood of the user doing harm by misinterpreting your data. Let's start looking at avoiding questions that may expose people at risk and how we can do that. There is a tool in the DTM and Partners Toolkit that was developed together with our protection colleagues in and out of IOM. It's called the Do No Harm Checklist. This tool is useful because it summarizes what you need to consider when you analyze the potential of doing harm of each question in your data collection exercise. Who can be put at risk through a data collection and IM activities? Well, the enumerators can be put at risk, the respondents, the displaced community, the host community, the organization itself or the implementing partner that is collecting the data, or even others. This is who can be put at increased risk. Now let's look at the IM cycle, the process of data and information management. We can do harm at different moments of this process. We can do harm when we collect the data. We can do harm when we store the data. We can do harm when we analyze the data or we share the data. And this harm can be done immediately when sharing or even after some time. You can find the Do No Harm checklist and a short explanation of how to use it in the DTM and Partners Toolkit at the link you see in the slide. But what does that mean in practice? Let's see some examples. For example, let's think of how we can do harm to respondents when collecting the data. Let us say we are interviewing individuals on the move, going through a border, for example, and we ask questions about violence they may have experienced. We may be exposing them to reliving their violent experiences without any possibility to receive help at the moment or in the near future. Or we may ask questions about trafficking to people on the move, when some people may still be in the process of being trafficked, and their traffickers may be with them. We're putting these persons at risk of being harmed further by their traffickers. Sometimes, in fact, it's sufficient that a person is approached by an enumerator and asked such questions, even when they refuse to answer or do not reveal any information. For the traffickers, they might become suspicious and wonder why we approached exactly that person. Did they say anything? Did they communicate in some way? We created harm for those respondents. Let us, for example, now think of how we can do harm to communities and beneficiaries with improper data sharing. Let us say we're asked to send information to the cluster about how many beneficiaries we have, and we share the file, an Excel file, with two sheets. One with aggregated numbers by age and sex. The second page with the entire list of beneficiaries, with names of each family, location, and what they received. That information was not needed by the cluster. We just forgot to send only the first page or sheet. We were tired, we made a mistake. Also, the Excel sheet was not password protected, and the information management officer of the cluster shared it further with other organizations without realizing that there was a list on the second page. The list got in the wrong hands, and some of the beneficiaries were threatened with violence if they did not give their share of aid to a gang. We created harm to our beneficiaries and their communities with improper data sharing. Let's look at another example now. We're working in a country invaded by a Western army. We have hired a number of local staff for our humanitarian activities. But they work keeping a very low profile, and they keep their link with us a secret from most people. This is because the other warring party considers it as traitor anybody who works with Western aid organizations. As we cross a checkpoint, our laptops get taken. The personal details of our local colleagues are on the laptops. The files are not encrypted, and one of the laptops was not even password protected. We have failed in safely storing data, and this is likely to lead to violence or threats to our local colleagues, who may be forced to flee their homes. We created harm to our colleagues and the organization with our own improper data storing. As a last example, let us consider how an assessment in a country identified the main sector of need in each location. As the respondents did not understand that what we meant by protection, nobody answered that their community was facing protection risks, even if displacement, family separation, GBV, violence and evictions were rampant. The analysis did not consider this and simply listed the responses of each community. Donors saw that protection activities were not among the top needs and decided to reduce funding for protection, GBV and child protection. In this way, we created harm to the communities who did not receive protection support and to the organization that saw their funding reduced with our own data analysis. What do we do then once we have gone through this analysis of the risk? If the questions we realize can put people at risk, we change the question and then reassess. And we do that as many times as it takes to identify the appropriate question to obtain the information we need without increasing the risk of enumerators, respondents, communities, and organizations. Let us now briefly see why we should always conduct a data sharing risk analysis before we collect the data. Remember that one of the PIM principles is coordination and collaboration. As we said, we can do harm if we share data without safeguards. However, we can also do harm by not sharing the data we have. For example, people who need that support may not receive it. Aid will be delayed and people may die. A good tool to help us understand how to share safely data is the Framework for Data Sharing in Practice. That was developed in an interagency effort organized by PIM, Protection Information Management, and OCHA. The framework includes some very practical suggestions on what to do and how to do it. In particular, I would like you to focus on the following actions. Define the purpose and potential outcomes of the data sharing exercise as a start, and articulate the reasons why sharing is important in that specific situation. Work with stakeholders within the context of a trust framework, and this needs to be based on professional competence, but also on the understanding of the skills and capacities of who we share with to safely manage the data we share. Also, understand the nature of the data being shared from a data protection perspective. Can this put people in danger? And we just saw how to do that. Assess current and potential future context. Review data collection processes and review informed consent. Establish data sharing arrangements and agreements and processes as early as possible. And finally, ensure that response actors have the information they need. If they do not have that information, they will not search for available data. Most likely, they would ask for another exercise to collect the data you already have, and this in itself can create harm. As mentioned, the framework has practical actions to minimize risks and maximize benefits of data sharing, and this is one of the examples. It's a short document that is available online. Another way of avoiding doing harm in information management activities is to start always from the use and the information needs and never from the questions when we design our exercise. This helps us ensure that there is a clear and documented link between the data we collect and the planned use of that information. This is where the PIM principle of defined purpose can help us. Not just each data collection must have a purpose, but even each question must have a defined purpose. A useful way to think about the purpose is to remember that we collect data so that decision makers can make informed decisions. Decision makers are those colleagues that make decisions at various levels for their humanitarian response. First, let us see the strategic level. This is about deciding where the humanitarian response should be implemented in a country, or which groups should we support it because they are in higher need than others, or what are the objectives of our response. The second level, what we call programmatic decision making, is about making decision of modality of responses. How do we intervene? What partnerships do we use? Who do we work with? Do we work with civil society and national organizations, or do we work with international partners, or with authorities and ministries and so on? The third level, operational decision making, has to do with how we implement in each specific location. As you can see from the examples on the slide, each decision-making level needs different information. Let us look at some examples. For what level of decision-making do we use the main sector of need in a region? Well, we use that for the strategic level of decision-making because we use it to identify sectors of aid that should be responding. Other example. For what level of decision-making do we use the specific number of persons living in a location? Well, we use that for the operational decision-making, for example, to identify the number of beneficiaries in a specific location. For what level of decision-making do we use a mapping of protection service providers? I would argue we use it for programmatic decision-making, to identify the type of support to services that is needed. It's always important to clarify the purpose of each information to collect, including the level of decision-making it will be used for. If we do not do that, we will not collect the right information at the right level of detail. The process to ensure we always keep the link between the use of an information and the data we collect is this. We walk backwards. We start not from the question in a questionnaire, but rather from the use, the decisions to be made. And then we look at the information needed to make such decisions that then the data users does not have. So the gap. But only at that point then we consider the right method and source of the data collection for that specific data, and then design the questions of the questionnaire. Let us see this process in practice with an example from child protection taken from the Global Child Protection Area of Responsibility Information and Analysis Handbook, the NIAF. We start from decisions that child protection actors have to make. For example, should we respond in this country, or is the government and local civil society able to handle it? If we have to respond, how should we respond? What is the aim? What is our strategy? Who are the children priority groups? Are they migrant or refugees? Are they poor children? Are they maybe children of specific ethnicities? Indigenous children, unaccompanied children, separated children. Where are these children and families mostly? In what areas? Are they urban locations or rural locations? How many should we support? Estimation of a target, of a target number. After seeing the decisions that we need to make, we look at the information that we need in order to make those decisions. What information do I need in order to decide whether or not to open child protection programs in a country? For example, if the existing child protection actors, authorities, civil society, NGOs, have enough capacity to respond to the new need. What information do I need in order to decide what groups child protection response will prioritize? Well, I need to know that what children groups are more at risk, they are discriminated maybe, or they're poor, or on the front line of a conflict, or in violent areas, or where they have fewer resources. What information do I need in order to decide what areas should I focus on? In what areas the child protection will prioritize their intervention? I would need to know the areas that are most impacted by crisis, where there are fewer services, and how many children live there. What information do I need in order to decide what response modalities to use in my activities? For example, we need to know the main risks of for children, how these risks are increased or decreased, existing effective mechanisms or actors that protect children, laws, family structure, for example, the role of the grandmother, the role of the parents, coping mechanisms, etc. Once we identify the information need, we look at the appropriate methods and sources to use. Let us take one of the info needs we identified in the previous slide as an example. We said that in order to decide what areas child protection response will prioritize, we need to know who are the children that are most at risk, how many children live where, and where fewer services are. Can I use key informant interviews, where key informants are not child protection experts, to find out who the most at risk children groups are? Maybe not. Maybe much better to use interviews with experts in child protection. For example, service providers who know who is more at risk in that area. Can I use the key informant interviews then to find out how many children live in each community? Well, for an estimate, yes, I can. Can I use key informant interviews to find out where fewer services are? Yes. Can I use key informant interviews to find out if the services are used and if all people are aware of them? Well, no, because of the nature of the key informant interviews method and source. I can't do that. Can I use individual interviews to find out if the services are used and if all people are aware of it? Yes. That would be a method and a source that I can use to identify whether or not people are aware of the services and use the services. For other examples, you can look at the NIAF Handbook, Annex 3, and the DTM Field Companion for Child Protection. And now, after we have identified the decisions we have to make as response actors, the information that we need but don't have, and then the method and source to capture that information, we develop the question and questionnaires. When we develop the questions, though, we need to make simulations, mock-up of results. We ask then the child protection colleagues, those that need the data or the information, to try and use these fake results in the way that we have given it to them. That is important so that they can verify that we are going to collect the data that they need, the right data, but also in the correct way, in a way that they can then use for their decision making. All this process will be documented in a data analysis plan. This is to ensure that both data providers, those that provide the data and collect them, and data users, our child protection colleagues in this case, are clear on what data to expect and how to use them before collecting the data. Remember that we never start without knowing what the end result will look like. We need to do mock-up simulations, just like you would never build a house without having a plan. Let us now consider whose role is it to carry out each step of that process. It's a joint process in which we all have specific roles according to our expertise. Whose role, for example, do you think is to identify the use of that information, which is the response decision that the information will help us make? Well, it's a role for the IM expert, for example, or is it role for the data user, for example, a DTM partner? It's likely the role of the data user, those who respond to humanitarian needs, because they are the ones who should know what response decisions they must make. What is the planned use of the information they're looking for and why they need that information. Next step, who do you think should identify the information gaps, which is the information that is needed to make response decisions but is missing? Is that a role for the IM or for the data user? It is a role for the data user again, as they should know what information they need but do not have, and they should tell the information management colleagues. Next step, identifying the methodology. Who identifies the methodology to be used? Is that an information management role or a data user? Child protection in our last example. It is an information management colleague's role to identify the methodologies to use in the context. And then it's also the IM colleague's role to tell the data user if the information that they are looking for can be collected with the methodology used or not. The last step, data collection tools and design, questionnaires and data plan. Who designs the data collection tools? It is really a role for the information management colleagues. However, once they do design the tool with help from the data user and the expert on the subject and on the context and culture they're working in, they do the mock-ups, and then the data user will have to verify before the data is collected that they can use the analysis that they will receive. If we don't do that, we really much risk to lose that link between the data we collect and the actual use of that data, and we risk to not collect data we need and collect data we cannot use. Very well. So far, we have considered a few examples of how not to do harm in our IM work. We said that we should avoid questions that may expose people to risk. We should explain to respondents how their data will be used, published, or shared, and we need to ask for their consent. We should conduct a data sharing risk analysis to identify which data can be shared with who and how, and that each question should have a defined purpose. And therefore, we start identifying planned use and information needs, and only after we write the questions. Let us now consider another example of how we can do no harm in our IM activities. Ensuring that the data are collected using the appropriate method and source. This is related to the PIM principle of competency and capacity. Why is this important to use the appropriate method and source? And how can we do harm if we don't? Let's give an example. What would you use if you needed to know locations where girls or boys or women feel unsafe, or main concerns of a specific group? Can you collect it through asking 3 non-specialist key informants per location? Will a man be able to tell you where girls or women feel unsafe? Would a member of the ethnic majority be able to tell you about the concerns and difficulties of the minority group? Would the observation by our enumerators, who are in the location for a limited amount of time, be able to provide the same information? Would interviews with households, where respondents are usually the head of households or other members speaking in front of the whole household, would these interviews with households be able to tell you about, for example, fears of domestic violence? Likely not. This is why you could use here focus group discussions, which are semi-structured discussion with specific groups, homogeneous groups, separately from other groups. Focus group discussion does not mean a group of people from the community. It's a homogeneous group, for example, women or children or adolescents or elderly or men or teachers or parents. This is because a group, for example, a group of women, may not speak in front of men or other groups as much as they would do when they're amongst other women. Using the wrong method and source, as in the example above, will result in misleading data that will not enable organizations and governments to provide necessary support, thus doing harm. In addition, using some methods, the example of household-level interviews to ask questions related to domestic violence, can actually cause direct harm to the victims of violence if perpetrators become suspicious of the reasons behind the questions in their household. Let us look at 3 methods and sources commonly used in humanitarian assessment, and let's try to understand what each one can and cannot do. First, let's look at interviews with key informants. These are individuals who are not sectoral specialists or experts. They respond on behalf of their community. This is widely used, for example, by DTM in their multi-sectoral location assessment. Let us start with what key informant interviews cannot collect. Here are some examples. Prevalence data on protection incidents, violence. How many incidents? How many children are married? How many persons with disabilities are there? That cannot be collected through key informant interviews. We cannot collect the dynamics of protection risks through key informant interviews. We'd rather want to use qualitative information from experts interviews or focus group discussions. We cannot collect what groups are more at risk with key informant interviews. We might collect how many people of specific groups are in a location, but we do not collect what are the groups that are most at risk. Again, for those, use qualitative information from experts or focus group discussions. We cannot collect through key informant interviews what are the factors that increase and reduce the risk. We should use qualitative information from experts and focus group discussions. Quality, access, and appropriateness of protection and healthcare services, we cannot collect through key informant interviews. Again, information from sectoral experts or focus group discussions. Remember, the key is always to think of who you are asking, their knowledge, their interests, and their concerns. We have seen what we cannot collect through key informant interviews, but there are a lot of things we can collect. And so what are they? These are the things, for example, that we can collect through key informants who are not sectoral specialists. Presence of groups most at risk by location, the estimates of the number of IDPs, the percentage of the IDPs over the local population, percentages of sex and age groups, and of vulnerable groups. So we cannot collect what groups are at risk, but we can definitely collect an estimate of how many people of that group are in a location. We can collect the presence of those factors that increase or reduce the risks by location. For example, we can collect presence of security actor. We can collect the land ownership and eviction threats. We can collect whether or not there are obstacles to personal identification documents. We can collect infrastructure information that are likely to increase or reduce the risk of violence or protection concerns. For example, if there are lights on paths, locks on the doors, separate latrines. We can also collect presence of fighting armed groups and explosive ordnance, for example, mines or cluster munitions in a location. We also can collect the availability of protection, healthcare, or other types of services. We said before, we cannot assess the quality and the use through key informant interviews, but we can assess the availability, the existence of these services. Let us now look at other two methods or sources that are very commonly used in humanitarian assessments. Individual interviews or household level interviews. Individuals interviews or interviews with individuals are when the individual is actually answering on behalf of themselves. And the household level interviews is usually done with the head of household or, in any case, likely in front of the whole household or many people from the household. And the person answering answers on behalf of the whole household. We cannot collect information that are part of a specific discipline or expertise. For example, we wouldn't use individual or household level interviews to understand the legal framework of a country. We do not collect, or we cannot collect, prevalence data on violence. How many GBV incidents have there been? Clearly impossible. The dynamic of protection risks. As said before, such question can even put some people in danger or a higher risk. For those, use qualitative information from experts or focus group discussions. Let's remember again, when we connect, that we cannot collect prevalence data on violence, not even when we use individual level interviews. Remember again to think of who you're asking, their knowledge, their interests, and their concerns. However, there are many things we can use, useful things that we can collect through individual level or household level interviews. These are some examples. Signs of stress in family members or in children, food insecurity, income, poverty, sex and age and disability disaggregated data, intentions, returns, new destinations, the use, the access, the awareness and quality of goods and services by group, barriers to freedom of movement, reasons for movement or reasons for displacement, coping mechanisms, whether positive or negative. These are all things that are extremely useful for our analysis that we can collect through individual or household level interviews. You probably noticed that we highlighted that we cannot collect prevalence data on violence from key informant interviews, household level interviews, and individual level interviews. Maybe we can collect, or we are able to collect, unaccompanied or separated children. We might be able to collect incidents of child marriage with, if we're very careful and know how to phrase certain questions. But how many children, women, or men have been raped, maltreated, trafficked, involved in hard labor, and other such information is not going to be collected in most of the contexts where we work. The reason is that these phenomena are hidden, they're taboo, or even crimes. The people interviewed will not be able to answer honestly or openly or with precise information, accurate information, because they either do not know or do not dare to respond. So even if we consider the police records or the service provider cases, we can only know the number of cases they were reported, which are far fewer than the actual cases. If we communicate reported cases and donors interpret them as prevalent, we can contribute to lower funding for protection programs. So the message is we cannot use any of those methods to identify prevalence data for violence. The good news is that the usefulness of this type of data, prevalence data, is deeply overestimated. We do not need to know how many cases of violence there are in a community to decide to open a service to help survivors. There is an agreement in the humanitarian community written in the 2015 Interagency Standing Committee Guidelines on Gender-Based Violence, which states this, saying, all humanitarian personnel ought to assume GBVs occurring and threatening affected populations, treated as a serious and life-threatening problem, and take actions based on sector recommendations in these guidelines, regardless of the presence or absence of concrete evidence. So let's learn to program, work, and survive without prevalence data and collect the data we really need. For example, we can use focus groups and interviews with experts to understand common patterns of protection incidents. Which groups are most at risk for each type of violence? Which elements increase or decrease the risk of violence for each group? As another example, the number of reported cases can help us estimate how many social workers do we need to hire? How much money do we need to budget for? So what we saw before were examples of methods and sources that can be used to identify specific protection, useful information for protection analysis. There is a tool that you can use that can help identifying the appropriate method and source, and it's on the DTM and Partners Toolkit. It's available online at the link on the slide. We said that we work together, we identify information needs, decisions, and then methods and sources to get that information. There is a simple tool in the DTM and Partners toolbox that helps data providers, information management officers or DTM, and data users, those who respond to the needs of the people, to work together. You see on the slide an image of the tool. It's called Map Information Needs and Methods, or Mapping Information Needs and Methods. How do we use it? Easy. The information management colleagues ask, for example, the child protection colleagues in our example before, what information they need and for what purpose. We just talked about the purpose defined for each piece of information. And then we write them in the first two columns, the columns that are called decisions or use and the columns called information needs. Then the information management colleagues explain which methods and sources they can use for each information and color the corresponding cells. The color is absolutely up to you. This tool helps colleagues from information management to understand what information they can collect with their exercise that would be useful for their child protection colleagues, and helps colleagues from child protection to know what information they have to find in another way or from another source. Of course, I was still using child protection as an example because we saw the example of child protection decisions and informations, but this really applies to any other sector as well. Let us now see the last two ways to mainstream protection and do no harm in our information management activities. As the previous example, also these are related to the PIM principle of competency and capacity. One is accompanying the data and reports with a detailed and transparent methodology document or chapter, and the second is to share the questionnaires with the dataset or the reports so that the user of this data does not misunderstand our data and does not do harm by mistake. It is key to remember that numbers have no way of speaking for themselves. We speak for them, we give them meaning. Without knowing exactly how the data was collected, we will not be able to give numbers the right meaning. So why should we share the methodology? Consider when you read an article or a study about something that affects your life. For example, stopping to smoke or exercising 2 hours each day or avoiding meat will help you live 35% longer and reduce your risk of respiratory and heart problems of 50%. Don't you want to know the meaning behind the numbers? Don't you want to see how the study was done before you stop smoking, become a vegetarian and sign up for the gym? A methodology that is transparent and detailed helps the user understand what the results mean and guides them to use the information correctly and avoids doing harm by misunderstanding the real meaning of the data. This is true both for data collection and also for analysis. In your reports, you must provide the information on how the analysis was done. On what basis are you giving this information now? So why share the questionnaire? Simply, if the user doesn't know the exact question that was asked, they cannot really make sense of the data. They cannot make the data speak. They will be confused, or they may be confused about the answer and may give them the wrong meaning. This has a high potential to lead to harm. Missed opportunities to support, providing the wrong support, not going to work in the places where the need is the highest, supporting some groups rather than those with fewer resources. An example from experience: forgetting to explain how data on protection cases were obtained created a false understanding in donors that protection wasn't a problem, and therefore no additional funding was given for protection. A transparent and detailed methodology and the questionnaires are the key to understanding the data. You can find a checklist on what to include in data and reports to help data users understand what the data really mean on the DTM and Partners Toolkit. It's online at the link on the bottom of this slide. In conclusion, what should we remember from this session on mainstreaming protection in data and IAM activities? There are various ways to mainstream protection in data collection, storage, analysis, and sharing activities. For example, avoiding questions that may expose people to risk. Do that do no harm analysis with a checklist. Explain to respondents how their data will be used, published, or shared, and ask for consent. Conduct a data sharing risk analysis to identify which data can be shared with who and how. Remember, you have the framework for data sharing in practice by PIM and OCHA. Start from the use and the information needs rather than starting from the questions. And remember that each question needs to have a defined purpose. Ensure that the data are collected using the appropriate method and source. And again, you have a tool on the DTM and Partners Toolkit that gives you examples of what method and source can provide what information or what type of information. Accompany the data and reports with a detailed and transparent methodology chapter and share the questionnaire together with the datasets and the reports so that the user can correctly understand your data and reducing so the likelihood of the user doing harm. And for that, you have a checklist of what to include in reports and datasets on the DTM and Partners Toolkit. Remember also that you can contact HQ for support. You can write also directly to dtmsupport@iom.int. And remember, mainstreaming protection in your work is your role. Thank you for listening to this presentation. If you're interested in other subjects, please check out the other available narrated presentations. Information Management and DTM for Protection by our DOE protection colleagues, or Information Management and DTM for Child Protection by the DTM and UNICEF Children on the Move project, or the Information Management and DTM for GBV by our DOE Protections GBV colleagues, or the Information Management and DTM for Counter-Trafficking by our colleagues in MPA.